I'm joining you today from Beaver Hills, a Muskogee, Waskahigan, Treaty 6 territory and Métis homeland. And thinking about as we gather and thinking about that traditional territorial acknowledgement, it's important to always think about the gifts of the land where we're gathering, wherever we may be, and the Indigenous people who share still today their knowledge and their struggles and their living experiences, and really consider deeply those teachings, those old teachings, those wisdom teachings, especially in the context of our conversation of COVID and climate change, and really how do we think about sustainability. And undoubtedly, there are many of us who've been having these conversations around kitchen tables or even on larger global platforms. And what are the lessons are we learning? And I'm imagining, and we're all concerned about how do we create a better future, within the thinking about those teachings of the next 7 generations. And I draw on that thinking about one of our Métis elders and knowledge keeper, Dr. Maria Campbell, who spoke at Big Thinking at the Congress, and she invites us to reflect more deeply and to act in regards to centering our children and what do we want our children to inherit. So as I was reviewing your bios and the purpose of today's conversations, those are some of the ideas or thoughts that were coming to mind. And so today, as you know, it's part of the speaker series of the Sustainable Council Lecture, which gathers interdisciplinary scholars, community people, all professionals, activists who engage in these conversations and actively engage in sustainability, climate change, and the environment or the land, or how we think about the places we live and how we live. So as you know, Hussein mentioned that we're being recorded, but all the listeners will not be visual, they will not be published. So this will be available on a YouTube series in the coming weeks. So really grateful that this conversation can continue and we can keep listening with our communities. And so before I introduce our very special guests, so excited, I want to thank and say Nina Skosamin to all the helpers behind the scene. Sometimes we have these events, I'm always impressed and amazed about all that invisible labor that occurs to make these events happen. So just a big shout out and keeping those efforts always in the back of our minds. And so my role, and very happy to have the pleasure to introduce Dr. Sherilee Harper, who is Canada Research Chair in Climate Change and Health, an Associate Professor in the School of Public Health at University of Alberta. And her research investigates these associations, weather, environment, public health, all in the context of climate change. And she collaborates with partners to prioritize climate-related health actions, planning, interventions, and researcher. She's also the lead author on the Intergovernmental Panel on Climate Change Special Report on Ocean and Cryosphere. Is that right, Sherilee? Cryosphere. Wow, what is cryosphere? God, I need
all the frozen bits of the earth.
Wow. I need to learn more. Cryosphere, I love it in a changing climate. So she's quite involved in the Intergovernmental Panel on Climate Change in various capacities. So we look forward to learning from you, Sherilee, today. Well, I've already learned my first lesson, cryosphere. And we also have Dr. Steven Hoffman. He is the Dahdaleh Distinguished Chair in Global Governance and Legal Epidemiology and a Professor of Global Health, Law, and Political Science at York University. Welcome to University of Alberta, Dr. Steven. Also, an incredible bio. He's the director of the WHO Collaborating Center on Global Governance, the scientific director of CIHR Institute on Population and Public Health. And he's also an international lawyer. who specialized in global health law, global governance, and institutional design. And Hussein will put the link in the chat for everyone who must read the incredible project and report that he was working on, a UN framework for the immediate socioeconomic response to COVID-19. So please, everyone, have a look at this, and I'm sure it will be on our website as well. So again, I welcome you both and thank you for taking the time to not only share your research and your experience, but sharing of yourself, who we are. We come here with all of ourselves and we sit at the kitchen table. So thank you for helping us to think more deeply and critically about the intersections of COVID and climate and living and being well. And so it's wonderful that the two of you know one another. And so I'll pass it to you to have conversations amongst yourselves and imagining that we're all sitting at the kitchen table, listening deeply, attentively, and taking notes. So merci, Ninas Kosamen. I pass it to you. Sherilee, you can begin.
Okay, sure. So yeah, where to begin? This is a huge topic, and it's a topic that I do think a lot about because climate change impacts the health of all of us, and it hasn't stopped just because there's been a COVID pandemic. In fact, it intersects with the COVID pandemic in a number of different ways. So maybe I can share a couple of ways that I see climate change intersecting with COVID. And then I'm really excited to hear from Steven directly about his UN report that talks about the COVID recovery and maybe the climate change role in that. So the first thing that I think a lot of people think about when they think about climate change and COVID is that, well, like, did climate change cause COVID? Did it increase COVID? Will it increase pandemics like that in the future? And there is some, growing evidence on that. And I will flag the IPCC, the Intergovernmental Panel on Climate Change, is releasing a report in February that will cover that topic. So science on that is evolving, but we certainly know that climate change can create these spillover effects and could increase the risk of pandemics into the future. But when I think about climate change and the intersection it has with COVID, I think about a lot of other things, like how COVID has really uncovered a lot of weaknesses in our healthcare system, in our health system writ large, and in public health as well. And a lot of those weaknesses in the context of COVID are also weaknesses in the context of climate change. For example, one of the things that we've seen through COVID is that there's this slogan that for COVID, we're all in this together. But in a lot of cases for COVID, we're seeing that we're actually not in this all together at all. And certain populations are at different risks of COVID and are experiencing COVID a lot differently than others. And I think that this connection between, social, environmental, and climate factors in the context of COVID is also really important in the context of climate change. Even recently, if you think about this past summer, especially here in Edmonton, but also in British Columbia, but right across the country, we saw these massive heat waves happening. And those, didn't pause because of COVID, they continued on. And that intersection or that convergence of the COVID crisis with the climate change crisis became really real for all of us. We experienced that. So for instance, when the heat waves happened, those mobilized public health resources, but those resources had to be mobilized in the context of climate change, so competing resources. But you also had to mobilize that response while considering things like infection control and getting people to cooler spaces or cooling stations, or reaching out to neighbors who might be more vulnerable and checking in on them to make sure they're okay. Doing that in the context of COVID and making sure that we still do that even though there is that risk of infection. And there are examples of that in the United States too, with hurricane season coming through. There was a lot of challenges for the healthcare system to respond to those emergencies alongside responding to COVID. And I guess, of course, the last thing that I always think about when I think about COVID, and what we're starting to talk a little bit more about now, I think in COVID is what does a COVID recovery look like? And to me, I think that climate change has to be part of that recovery. And that's something that actually Steven covered in his UN report. So Steven, I'd be really curious to hear from you, like what you see the key things are for us to consider in a COVID recovery that considers climate change.
Yeah, thanks, Sherilee. And first, let me just thank the University of Alberta for convening this discussion. Sherilee's a friend, so it's how great is it that we get to do this together. And Cindy, thanks so much for hosting us today. It was about a year ago, or just over a year ago, that if everyone remembers, the pandemic was it was still at that earlier phase, very unpredictable. We didn't know what was going to happen, and we still don't fully know how this thing will end. But what we did know at the time already was that there were massive socioeconomic consequences from the pandemic. And that in a sense, the pandemic presented as a prism through which we could see many different challenges. Now, the pandemic didn't cause every bad thing that's around in the world right now, but it did, for many things, magnify or accelerate some of the challenges, or in some cases, actually prove to be a grand revealer of things that had long existed, but which now, in light of the pandemic, everyone recognized are totally unacceptable. And when you think of it then in that way, it became important to think about the pandemic not just as the spread of a virus, but also as the follow-on consequences of that spread and the range of efforts that were needed to address it for people's lives and well-being. And so with that in mind, it was about a year ago, the UN Deputy Secretary General invited me to lead the development of the UN research roadmap for the COVID-19 recovery. This was out of recognition that we needed early on in the pandemic to already start to think about what kind of knowledge will we need in order to get not just any recovery, but a better recovery, to be able to ensure that we are able to leverage what we've learned during this pandemic in order to get to a better future, because the old one wasn't so perfect as we were living. And I think then, Sherilee, in my view, there's like three kind of grand challenges, that definitional, generational challenges that we currently face. One of them is around climate change and around that we are living unsustainably on this tiny blue dot in this universe. And our future does not look bright so long as we are essentially living beyond our planetary boundaries and causing changes in this era of the Anthropocene in ways that weren't previously the case. Second is inequality. We live in a very, very unfair world. And being in an unfair world, that means that for some, including myself and maybe some others joining this webinar, have been able to benefit from that inequality and live quite comfortable lives. Of course, everyone faces their challenges, but when comparing to folks, the billion of people in the world who live on less than $1 a day, it's quite stark, the kind of depravity in which some people around the world live. And third, we were not resilient in our world, in the sense that once we had shocks come, whether it's a pandemic, whether it's a hurricane, an earthquake, or a new vector borne disease that comes up in a place that had never come before, we're not resilient to these types of things. And as a result, our systems break down. We face some major consequences. So with that, the UN Research Roadmap was really an attempt to identify the key knowledge needed to build back in a more sustainable way, a more equitable way, and a more resilient way forward. And what's really interesting, Sherilee, and I'd love your thoughts on this, is that, I identify those three sort of generational challenges that we face and that the UN Research Roadmap tried to tackle using COVID as the prism for it. But they're all really interlinked, right? So climate change, of course, is one of those things that is making the fact that we're not resilient a problem, because it, of course, as you just described, it's accelerating things like hurricanes. It's bringing new vectors into areas that previously had never seen those kind of insects, for example, and such. But also the consequences then of climate change in light of inequality are not equal. And so I remember it was a year or 2 years ago, there was a study out, I think in Science, that was highlighting that there's a certain geographic area in India that will become so hot by the end of this century that people will not be able to live there. And yes, on the map, it looks like a small area, but that's where 100 million people live. Totally going to be totally uninhabitable for humans. by the end of the century. That's crazy. Sherilee, any reactions to all that?
Yeah, I mean, that was such an interesting study, and what is sort of terrifying, really, is that since then there's been a lot of other research that's looked at that around the rest of the world too. And just this past summer in August, the IPCC released its most recent report on climate change and the physical basis of climate change. And part of that included projections that show there are even parts in North America that will become like uninhabitable by 2050. And what's even like more frightening is that this is happening way sooner than we thought it would. Some of these impacts, we're expecting to see those hit by mid-century. And in fact, there have been even certain days of the year in the past 5 years where we've seen those temperatures be hit in those areas. And of course, that is something different one day versus, like a longer period of time. But those are, very, very stark indications of what is to come. And I think that when COVID first happened in the climate change sphere of things, there was a little bit of optimism in terms of greenhouse gas reduction, because I mean, we're in a situation now where, of course, we know from a health perspective that we have to adapt to climate change. Even if we completely stop emissions today, we're going to see health impacts rise in the future. But we also know that if we don't take drastic action now to reduce those greenhouse gas emissions, our health system capacity to respond to climate change impacts will not be up to the task. So it raises this importance of emissions reduction. And I think that early days in COVID, there was some optimism that, well, in such a short period of time, because the economy essentially shut down, and we saw these pretty drastic drops in greenhouse gas emissions and other emissions. But what we have seen since then is that those were not sustained, and that was really a small drop in the bucket in the big picture of things. And even if we were to try and continue that type of emissions reduction, that would only reduce global warming by about like 0.01 degree, which is a long way from where we need to be mid-century. But I also think that there's a lot of opportunities and a lot of things we can do to act so we don't go down that road. One of them, for anyone who's in Alberta on the call, is the municipal elections today, is to go out and vote. That's so important. And actually after this, I'll be going out to vote. And looking at climate change and also health policy, like pieces of the platform. Even though health isn't a municipal responsibility, they do have a role to play in terms of things like active transport, which is good for climate change, it's good for health, and it's also good for COVID too, because healthier populations will do better in the context of COVID. The second thing that I think everyone on the call can do is pay attention to the upcoming United Nations Framework Convention on Climate Change. They have a Conference of the Parties coming up the 1st and 2nd week of November, where there will be major international negotiations on climate change policy. And that will be really critical and really important. So I encourage everyone to pay attention to that, but to also follow up with all of our politicians on that topic, from municipal right to federal. And then one other thing that I know CIHR has been paying a lot of attention to climate change and research and COVID and research. So Steven, one question I have for you is what's on the horizon for climate change and COVID research at CIHR? And do you see these intersecting? Do you see there opportunities to strengthen climate change research in Canada?
Yeah, thanks, Sherilee. Before I answer the CIHR question, which is a good one, I did just want to say I'm so glad you mentioned about voting. A lot of being democratically engaged is probably one of the most important ways that we have to properly steward collective resources that we all need to share in the management of. And my own research is very much about global collective action problems. I don't, in most of my work, I'm not focused as much on climate change. I'm focused more on things like infectious diseases that spread across borders. But a lot of my more recent research has been trying to draw lessons from climate change. And you mentioned the Framework Convention on Climate Change, for example, the COP, the Conference of Parties meeting coming up. But that learning from the various politics of climate change, applying it to public health context and trying to figure out what we can learn. And I think there is a lot to learn, but we can continue that conversation. After you did ask me about CIHR, so I do, as you suggest, in addition to being a professor at York, I have this role where I'm working for the government of Canada, leading on the funding of public health and population health research. And I can definitely say that climate change is, as I said, it's one of these generational defining issues. It's certainly a priority for the current government. And as a result, CIHR is definitely exploring ways in which to support this area of work. I think one of the challenges is that this is an area that cuts across all the different funding councils. You know, it's one of those things, on one hand, it's everybody's business, but then because it's everyone's business, there's too many times when, whether it's different levels of government, whether it's different countries, who are each sort of identifying maybe it's not for them to take the lead on and not. And I'm not saying that that's what's happening with the research funding, but you know, when it's worked well in Canada is when the different agencies have come together and offered joint funding opportunities, as happened quite some years ago. And certainly I personally can't think of a better issue for NSERC, SSHRC, and CIHR, so the three funding councils in Canada, to come together on than the issue of climate change. I just can't think of a better issue.
Yeah, I totally agree. I mean, I think that climate change is this topic that it really requires team science, and there has been a lot of articles written about that need in in high impact journals like Science and Nature. And the other thing that I'm seeing increasingly called for, and I think this fits into some of your comments on COVID earlier, is a need for not only a range of disciplines to be involved in that research, but also a range of people to be involved. Because if you look at the top, most highly influential climate change papers in climate change science, so that's not just climate change impacts on the health, that's climate change writ large. It's largely white European males who are publishing in that field, and some of the most important groups in the climate change context are being overlooked. And that type of research that's led by those people is really needed. And I think that gets to your topic of equity. And one thing that I really appreciated in your UN report was this sense when you read it that it's not just about building back better, and it's not just about building back greener, but it's also about building back fairer and more equitable. And that I think is an important message that also cuts across all different disciplines too, and not just health sciences.
Definitely. You know, it's in some respects, that report, I think it resonates, and it's resonated in different places around the world. It's actually been really great to hear of different countries picking up, and actually not just to inform their research agendas, which is what it was intended to inform, but in some cases we've heard of governments making use of it to inform their policy response to COVID-19. And so the fact that equity is baked into the DNA of that roadmap, I think will hopefully help point people towards at least the kind of questions that we should be asking, whether it's about the digital divide, whether it's about the way that development finance is currently organized, whether it's around how communities can be empowered at times of crisis, when some of the traditional means of community engagement, like town halls and such, are no longer available. Having those questions at the very least, and hopefully through research, some answers, can help guide that way forward. Sherilee, I did want to ask you, so I think you are doing some of the coolest research in Canada that I know of. You are heavily involved in the Intergovernmental Panel on Climate Change process. I mean, most Canadians, including me, we hear about those reports in the newspaper when they come out. It's always bad news, as it needs to be, because we need to jolt people into action, and the science says it's bad news that's coming. Wanted to find out from you, what is it like to be working in those groups? What's sort of how does it all actually come together? I know that in some respects it's pointed to as an example, and frankly as an exemplar for how science can get a voice in politics. And yet you also flagged that a lot of the researchers leading that effort are, for example, not necessarily representative of the diverse group of people who inhabit this planet.
Yeah, I mean, that's a great question. And I mean, I love the IPCC and I love being involved in it. It is definitely not perfect, but it is a really cool process. I mean, that really quickly at a high level, each country gets to nominate authors to serve on an IPCC report. And so, for instance, in Canada, there's a call for applications, and they review the applications and they put nominations forward. And then that's usually like, thousands of applications get forwarded to the IPCC. And then they select, depending on the report, and anywhere from 100 to a couple hundred authors. So on the current report that we're working on right now, that will be released in February, there's about 200 authors that are selected. And that's, climate scientists from all around the world on every single topic you could possibly imagine, from like anthropology to people who study migration, to people who study, like biology and spillover effects, to people who study forest fires, like everything you could possibly imagine. In fact, there's only, a small handful of health people on those reports. And on the report on the ocean and cryosphere that was mentioned earlier, I was the only health person there. So it's a very interesting interdisciplinary team of authors. And the IPCC is making a lot of effort to try and make the authorship more gender balanced. They did have a gender task force that was put together, and we made recommendations on how to improve that, and you can start to see that happening. And they also place a huge emphasis on trying to have authors from different places. So for instance, on the upcoming Working Group 2 report, which focuses on adaptation and impacts, which is going to be released in February, about half of the authorship is from developing countries, for lack of a better word. So there is a lot of diversity there, but the rigor and the advancing science piece, it's amazing to be a part of, because you just learn so much. I mean, you're completely outside of your discipline every single time you meet. And these reports take a couple of years to put together. So it's a long process. And at different points along the way, it goes out for peer review. So anyone with a science or research background can review them and provide comments. Every single government provides comments. So there's lots of comments from government. And then at the very end, we create a summary for policymakers. And that gets approved line by line with all the UN member states. So it's a pretty rigorous process, and there will be thousands of research articles that are assessed on it. And it really is the state of knowledge report. But what's really unique about these reports, and what makes them different from other climate change reports that you're constantly hearing about, is that this is approved by different UN member states, so by different countries, and the governments approve it, and they agree that this science is real and rigorous, and they agree that they're going to take action on it. So at the upcoming UN COP, climate change COP, that's happening the first 2 weeks of November, they have to take those reports and base their decisions on those in their international negotiations. So they are really important reports, and anyone can review them. So everyone on the call, I suggest that when those opportunities come up, to do it, because those reviews really do shape the report, and every single comment has to be responded to.
I'm going to jump in because that was one of the pieces, Sherilee, is I was wondering, both of you in your work, it's like, how do we know, like, whose hands do we want this important research to get into? And then the accountability behind this incredible labor, these resources, investment in this research that is occurring, so it's interesting at the UN level that they've actually have to be accountable to that. But the accountability piece is probably one area that's a constant missing point when we think about things on a very global level, on a local level, on when it comes to any kind of change, social change, critical change, radical change,
Yeah. I think you make a good point about accountability. It's, it's one place where I think in the climate change sphere, there has been some really interesting models, like even just having a global unifying target in the form of 1.5 degrees Celsius, that the global average temperature should not exceed that, is in some respects maybe banal, but actually quite radical at the same time, in the form of providing a barometer against which we can actually measure our progress, or the opposite of progress, in terms that everyday citizens, that people like me can actually understand. Because I wouldn't understand the other metrics, the ones that Sherilee will use in her research, whether it's about different emissions and such, but degrees Celsius I get. And, when thinking of COVID, to bring it back to the intersections of climate and COVID, I don't think we have a global unifying target. a unifying political barometer for whether we're making success. And the reason I say that is it's clear some countries are focused on just mitigating the consequence of this pandemic for their own populations. Whereas some other countries, although I can't think of many, that are focused on trying to end the pandemic for the world. And what that does is, by having different goalposts of what we're trying to achieve, it means we have some weird situations right now. Like there's big discussions about deployment of booster vaccines in some high-income countries, when actually most of the world has not yet received its full vaccines, its initial vaccines. And so that highlighting that kind of accountability, Cindy, like you mentioned, whereas there is this sort of framework and process in the climate change world, we don't have that with COVID, and that's causing, I think, real problems. It's not framed as such in the news media, but pursuing different goals vis-a-vis a pandemic means that we're not actually optimizing our global response.
Well, then it's part of that equity piece, right? And it's unfortunate that we're not being better informed through the medias of what's happening on that global level, and where there is discrepancies of, I know people who know people in parts of the world that their relatives haven't even been vaccinated, haven't had the ability to receive the vaccines, and sometimes in North America, so it depends what lens that we're looking things, right? In North America, the debates on who is vaccinated or not vaccinated, which just distracts from such a larger, more deeper conversation that's required, and therefore action. I'm going to turn to, we have a few questions we have here on our chat. So is it okay, Steven and Sherilee, that we turn to some questions on our chat? Perfect. I feel like we could just, oh my goodness, have a whole day of learning from one another and having these important conversations. But you've pointed to so many important pieces. I've got tons of notes, but I'll leave that aside and I'll go to our listeners. Marina's asking is, how does adaptation, acclimatization play a role in our response to climate change and the emergence of infectious diseases? Oh, my timer.
Yeah, that's a great question. Thanks so much, Marina. Yeah, I mean, adaptation is going to play, it already does play a really critical role, actually, in terms of climate change, because we've seen how climate change impacts health already in the past 10 years. And that the evidence on that is very, very clear. And what we know is when there are adaptation strategies that are available, which is essentially, in a health sense, our ability to respond to those. So during heat waves, providing cooling stations, providing water, checking in on neighbors, those types of things are adaptation strategies. But what we need to do is go from like a primarily reactive response to more of a proactive response, and think about things like our building design. Thinking about things like energy and where we're getting the energy from. Those are things that we need to start paying more attention to in the context of adaptation. And that's a heat example, but in terms of infectious diseases, from a more like health science side, and Stephen, you probably have comments more from like a policy perspective, I think that that's also equally important. So if we think about things like deforestation, which is a major driver of climate change, it also creates environments where there can be these spillover effects of different zoonotic infections that can come and spill over into human populations. And then we have these big, huge pandemics. And importantly, COVID-19 is not the first time that type of thing has happened. Not saying that climate change caused COVID, but that type of transmission pathway has happened in the past before, and it's going to happen again in the future. So we have to start thinking about that and preparing for it.
Yeah, just to add in the policy side of it, we as societies and societies around the world need to be thinking about what's coming, because their climates are changing. And so being able to model, predict, and then actually proactively create policy frameworks that are able to address those challenges before they affect people's daily lives is essential. I think the forest fires this past summer in Canada and Western Canada is such a good example, because those weren't I mean, those weren't a surprise to those who were in the know, and that I mean, it was 10 years ago that winters were sufficiently warm in BC that the pine beetle was no longer being killed off in the winter, which meant that more and more pine trees were becoming more like tinder, and then creating more fuel for forest fires. They happen, causing more air pollution, which causes more asthma and other types of reactions, resulting in, I was told, unprecedented numbers of cardiovascular events in Alberta during those periods when the forest fires were raging. And so in that respect, we can look at the final cause and be like, okay, more heart attacks. Let's open up more emergency rooms in Alberta hospitals. And I'm not a healthcare expert, so I will defer to others on what makes best sense for spending resources and such. But we knew this about 10 years ago, that this was going to come. And taking a look at the policy frameworks today, I think could provide a learning opportunity for how we can ensure that the other types of pine beetle things, or viruses, or earthquakes, or hurricanes, or other types of things like that, that we are better prepared for these full range of effects.
Amazing. Thank you, says Marina. We have another question here from Sheila. She asks, given the short time frame to reduce emissions and how slowly governments move, what are the top 3 things that civil society can do that will have the quickest impact?
Should I go first, Sherilee? And then, okay. Yeah, so top 3. So it's a really good question. And thank you for it. I think the number one thing is to bring attention to these issues and not stopping in bringing attention. Our particularly democratic societies work very well in responding to public pressure. And partially that's because, as Sherilee mentioned earlier, it's because the governments who are sort of operating the machinery within those democratic societies know that every few years they're going to face an election where they'll be judged by the people. And so democratic governments are then very good at keeping an eye on what do people care about, what influences their votes, what kind of action do citizens expect of their governments. And so any effort that further brings attention to this as a priority for citizens, that votes are on the line for it, I think will be extremely productive. And I think there are other things that can be done, of course. Climate change is not just a domain for governments to act, it's a domain for companies to act, it's a domain for hospitals to act. Our healthcare system is extremely not energy efficient and produces tons of waste, but also for citizens, every citizen needing to act. So to the extent that civil society is able to mobilize people around these challenges that we face, demanding that companies serve the greater good and are thinking about, yes, they have their financial goals, but they also need to have their social goals and their environmental goals as well. And really holding people's to account for that, I think, is essential. Sherilee, what did I miss?
Yeah, no, that is the number one thing, because honestly, on an individual level, we're not going to be able to get there, and we're not going to be able to get there fast enough. And this has to be something that we come together on. And like one of the fastest ways to do that is through government. And yes, government does act really slow. But I have to say that even in the past 10 years, the focus and energy and interest and prioritization of climate change has completely changed. Completely. And I think that a large part of that, this is my personal opinion, is because of all of the youth climate action that has really brought attention to this issue in a really big and important way. And it continues to, it's driving it. Like 10 years ago, climate change was not an election issue. Today, it's an election issue, and it's on every single major party's platform. And even in the the municipal election right now, it's on almost all of the candidates' platforms. It's a really key topic, and it's a key topic because people are demanding that of our leaders. And companies have to change too. And I mean, honestly, there's a lot of interesting things happening in the United States right now, drawing parallels between what happened with like sugar and tobacco in the United States with these major corporations, and in terms of like what messaging they're putting out there and what misinformation they're putting out there, and parallels to what we're seeing with climate change is literally unfolding right before our eyes in the United States. And I think that companies would love it if we all took individual responsibility that the climate change is ours, or climate change action is our responsibility as individuals, but it's not. Like, companies have to take responsibility too. As individuals, though. Yeah, and
I love the analogy of tobacco.
Yeah, and it's true. And I mean, it's happening. These things are being admitted, documents are being leaked. There have been entire campaigns to try and discredit individuals, to try and discredit scientists, to try and, bend the message and promote misinformation. As individuals, we can do things too, of course. And I think one of the most important things we can do is talk about it, and have conversations about climate change and mainstream that. And of course, individual responsibility matters, and I take that personally really seriously. But I think that collective action that you talked about, Steven, is absolutely critical.
And I think that there's the piece around the generational element that you spoke about earlier. It's like having those conversations every day with our families, with our communities, at the table, in our classrooms, in every possible context, with those different lenses to examine it, and make it part of I love that she's asking about civil, what is our responsibility as thinking about a civil society. You speak
Cindy,
about...
just before we go to the next question, I was hoping to ask you, Sherilee, by making the tobacco analogy, I think you were highlighting that, so back in the day, there was a lot of efforts by tobacco companies to manufacture doubt about whether tobacco was actually causing cancer and other forms of disease in people who use tobacco. And then it was around secondhand smoke, and then there's all sorts of efforts to manufacture doubt. One of the things I hear a lot about is this idea of clean coal, which from my understanding doesn't actually exist. I mean, maybe there's slightly cleaner coal, so slightly cleaner, very, very dirty products. But but you know more than me, is coal the new tobacco? I won't talk about oil, but I'm talking about coal. So I'm talking University of Alberta. I can't talk about oil, but
yeah. No, it's true. We have to transition, and I think that even the provincial leadership in Alberta is talking about that. We can't avoid it any longer. And I think that if we do, we're just not we're being too insular in our thinking, because the rest of the world is moving ahead, whether we like it or not. It's happening, whether it's coal or oil. And in the United States right now, there's major hearings about to happen with Exxon to hold them accountable for some of that misinformation that they were spreading about climate change and greenhouse gas emissions. In the exact same way and manner that it unfolded with the tobacco industry. Air pollution matters, and it impacts our health. I mean, even coal, mining and everything about the coal industry impacts human health. And of course, fuels climate change, which also impacts health. And there's also been a lot of research from around the world in a COVID context showing that in places where air pollution is higher, the adverse outcomes from COVID are much, much worse. And so again, you see that interplay of all these different factors coming together to impact, the health, to impact society, to impact the environment, to impact climate change.
I guess it's not just the coal companies themselves, but the banks that finance coal, the insurance companies that de-risk it. It's quite a challenge, and of course, there's people's livelihoods are dependent on these companies. So I don't mean to vilify, but the same could be said about tobacco back a couple or more than a couple decades ago. And certainly thinking about it, you're drawing that lens and the learning. I guess I'm trying to think, what can we learn from that experience with dealing with tobacco companies in the context of, coal companies today? I don't have an answer there, but it's an idea that was generated from your comment.
It's a really important point, and we can't leave those people behind in our conversations, right? Like we want everyone to have rewarding, well-paying jobs. That's an important factor that can't be ignored. At the same time, you know, the economy is not like, you know, synonymous with greenhouse gas emissions. Like, you don't have to produce emissions to have a thriving economy, and it takes really, it will take really good leadership to help the entire world, not just Alberta, transition into a cleaner economy. And it's happening. I mean, the writing's on the wall. We have to get there, and it'll take strong leadership to get us there and to leave no one behind. And again, this draws on a lot of the things we've been seeing with COVID and inequities there, and access to different social programs and everything else. All those things matter, and they matter in a climate change context too. We can't forget about those.
You're making me think about, and I've been thinking about this in preparing for today, but also watching the news and listening, and even participating in the movement of thinking about climate change differently and thinking about climate justice. And does that, for the two of you, change the trajectory of how we look at the systems of power, how we examine, how we engage, how we participate, when we think about climate, rather than climate change, or not rather, but thinking about it as climate justice? And I know it's kind of off a bit, sorry, there's a list of questions that are still coming through. So, but your conversations kind of brought to the forefront, like, what occurs when we, I often think about what occurs when we shift that lens. Yes, it's complex. Maybe we don't want answers because the solutions are as complex as the problem, and the origins and how we perceive and think about it. But what happens for you in your work, in your role, if there were a re-examining through climate justice, as we see the parades of the young people, like you said, Sherilee, people are taking the streets, and it's not new. This has been happening for decades and decades. So I don't want to ever think that these are new movements. Yeah.
Yeah, I mean, I think it's critical. Climate justice is absolutely critical. And Steven had these really great points earlier about how with COVID, we don't have these like target, like sort of goalposts or markers that we're trying to work towards. Whereas in climate change, we do. And that's true. At the same time, we see a lot of, I don't know what you would call it, in the context of COVID, governments being very nationalistic and really looking at national interests ahead of the global interests in the bigger picture. And we see that with climate change too, and climate justice. The countries who are the biggest climate change emitters are not willing to, equitably respond to the climate change threat. And those countries and those places that produce the least greenhouse gas emissions are often the places that are some of the most hardest hit by climate change. And that's completely unjust. And that needs to be done better. And it will be really interesting to see how that unfolds at COP in November. I hope that some progress is made towards that, but we have to keep pushing for it.
I think though what we've seen in COVID doesn't reflect very well on where the future is likely to go in these kind of collective action problems. There's nothing sort of more stark than life and death, and in a context of a global pandemic, access to vaccines for some people will represent a life or death matter. And so seeing how nationalistic every country in the world has been in this pandemic really, for me, emphasizes that how difficult it's going to be to make progress on something like climate change, where it's not, well, it is life or death, but it's not life or death in the immediate. It's the long term, of course. Already, just making sure we emphasize, already there's 150,000 people who die every year from climate change, directly from climate change. And so my point, though, is if it's been so hard to get a global approach to addressing a pandemic, for things like vaccine equitable distribution, then gosh, how are we going to get even like the necessary level of action on climate change? And I mean, we've seen lots of action. That's, I think, where the optimist in me is quite excited that there are change, there is public awareness. It is now a political issue where politicians are fighting on who the greener party platform. But at the same time, when the rubber hits the road, are those actions there? And we know that they're not there to the level that they're needed in order to meet these goals. And I think for COVID, for me, it really highlights how much work, how much political work, how much legal work, economic, cultural, social work we have to do.
And honestly, what you just outlined there, Steven, watching that unfold in the context of COVID is literally what keeps me up at night about climate change. Like it really does. We really do have to work on that in the context of COVID, but that spills over into other topics, including climate change.
And
it's a little depressing.
Yes,
sorry,
well,
Cindy.
No, that's okay. I think hopefully you've answered. I'm looking at the questions. Most of the questions touched upon that we have coming through to the chat. We've got only a few more minutes left, and you gave me you sparked something inside of me there in that conversation, and it might be gone. But let's build on what you've just shared in terms of.
Yeah. Cindy, one thing I was going to ask Sherilee, if one idea would be, I'd love to get Sherilee's thoughts on around science communication. You know, one of the things that climate change encountered for decades was, as I use that term from the tobacco companies, that manufacturing of doubt. Well, I guess initially there was a debate about to what extent does human activity cause climate change. For decades, we've known it's the primary force that is shaping the nature of our planet, this tiny blue dot in the universe. And yet, of course, there's so much financial interest wrapped around that conclusion that there was all sorts of very deliberate strategic efforts by folks, by companies and others to perpetuate this as a debate. And I remember a couple decades ago talking about, is balance fair in media, right? So let's say you have 10,000 climate scientists who are saying one thing, and then there's one fringe person saying something else, and then bringing them both up onto TV for a debate is just ridiculous and actually conveys the wrong message. And yet we see a little bit of that, not as bad as what I remember from 2 decades ago on climate change, but we see it today with COVID in the sense that there's a very noisy information landscape filled with misinformation, or in some cases disinformation. And how do we deal with that? Because from my perspective, it's so easy to lob fake news out there, right? You just throw out a tweet and it could just be, it's just so easy. You can get AI just to generate all sorts of disinformation. And yet it takes so much energy for public health officials in this case, or climate scientists in the case of climate change, to actually respond to it and explain why it's fake. How do we deal with this?
Yeah, I mean, and I think that's a really important question. And you're right, we see that in COVID too, right? Like we see this, like, wanting to cover, both sides of the story, but that a lot of that comes down to responsible journalism. And, I think that's come a long way, and it's really important. And there's a lot of really major news outlets like The Guardian, who has removed, a lot of different news outlets have removed the paywall for any climate change content, for instance, trying to make it more accessible. There's been a lot more research that's been done that has been looking at climate science denial. And really interestingly, actually, a lot of that work is strongly influenced by health sciences. Because health scientists have been dealing with misinformation for a very long time. Like we've already talked about COVID, but also anti-vaxxers, writ large, and in terms of MMR vaccines and other things. There's a lot of examples of that in the health field, and a lot of research that's been done looking at how to effectively communicate. And what's really interesting to me is that I often see those same lessons learned applied in the climate change context. But I think that the climate change field and science is actually quite far behind, and needs to do some catching up. So I think there's some important work there to do in the climate change realm, because the science is still being undermined, especially in places like the United States. And this report that I keep mentioning that comes out in February, that the North American chapter has a very good section on climate science denial and the impacts that has on climate change action in North America. And it's pretty it's pretty serious. But yeah, lots of lessons that can be learned from the health sciences, and it's hard. And in the IPCC context, I get confronted with climate science designers all the time, and it's misinformation. It's trying to drive wedges. It's trying to consume you, like, take all your time in things that aren't important and to distract you. The tactics are the same across the board.
Well, I want to acknowledge the two of you. I was going to ask you a last question, but our time is coming to an end and to a close. So I want to thank all the listeners and acknowledge the two of you that, one of the things I wanted to ask, but I don't need to ask because it's evident in your presence and your voice and what you're sharing is that, there is a starkness to the research. There is a starkness in terms of the sustainability of our earth, or however we think about what's sustainable relationship in so many levels. And yet you remain hopeful. And so I want to just close our session by just acknowledging that hopefulness that you're bringing to the table, that critical piece that we can, because hopelessness comes when you feel helpless, but where no one's helpless, right? There's no such thing as it unless you engage into that. And I love that, remaining critical of that manufacturing doubt. Like, how exciting is that for me? That gives me joy every day. If I could just God, how's the patriarchy today? Let's talk about it, and let's unpack it and let's see how we're enacting it and just keep remaining vibrant and vital. And so you've really brought that to our conversation today and to this space and not a fake hopeful either. It's kind of, there's sustenance, there's substance, and a really beautiful energy and thinking that we can all continue in whatever capacities that we can, and mobilizing on so many levels. And seeing, I'm excited to think now more, what are people doing where is it working? Let's see research on that also. Let's see research where in communities and in places and spaces, those intersections are being addressed on so many levels. Where are the microcosm spaces that we can also look to? That surely, because human beings, we've been around for a long time. So surely there's more lessons to be learned and continue to be learned historically, and even thinking about our future. So a big hi and merci to each of you, Steven and Sherilee, and to all our listeners. This was excellent. Some of the chat, this was excellent. Thank you so much. Lots of thanks coming from the chat feed.